Hello everyone. Today I would like to brief you all about another very important complication of diabetes mellitus. It is nothing but diabetic kidney disease, or what we call as diabetic nephropathy. Why is this important? It is because diabetes is even today one of the leading causes of chronic kidney disease, which, if left untreated, can lead the patient to chronic kidney failure, requiring dialysis and even kidney transplant in the last stages. Again, why am I talking about this? Because diabetes kidney disease is again a very silent complication of long-standing uncontrolled blood sugars. So how do you go about managing this? First and foremost, I again repeat, excellent, very good blood sugar control. Follow the advice of your physician. Make sure your lifestyle modifications are always there. You maintain it because consistency is very important. Along with that, take your medications as prescribed by your physician and go for your regular checkups and make sure your 3-month average, the HbA1c, is below 7%, because researchers have found that when the HbA1c is maintained below 7%, your risk of developing complications due to diabetes are at a minimum. Anything else that you can do? Yes. Your routine blood test, please get your kidney profile tested. But unfortunately, in the early stages of kidney disease, the blood investigations can be normal. So what else? Get your urine tested. What will you look in your urine? Look for urine protein, that is the urine albumin leakage. Your physician will write and give you something called as a urine microalbuminuria. So if present, that will indicate the early stages of kidney damage due to long-standing uncontrolled diabetes, so that you can take the necessary actions and prevent progression of the kidney disease in you. Is there anything else? Yes. I would always say the eyes and kidneys are best of friends. You can see your kidneys through your eyes. So, in the early stages of your kidney disease, there are retinal changes. So, as I had mentioned in my earlier videos, please go for your yearly eye checkup and get your retina checked. Because if there are early changes of diabetic retinopathy in you, then you know your kidneys are also beginning to show early changes due to long-standing uncontrolled diabetes. Why is this again important? Because if we allow it to progress, if we are not aware of the underlying kidney issue in us, it can progress to kidney failure, requiring dialysis, and even a kidney transplant in many. Also, a very important point here to note is, we have found through researches and various studies that there is a familial predisposition, that is, a diabetic individual who had a family history, that is, whose father or grandfather or maternal side have had kidney disease due to diabetes, then that person stands at a greater risk of developing diabetes-related kidney complications. So if you have any such history in your family, don't panic. Just follow up with your physician regularly and make sure your sugars are under control and you get your kidneys checked every year, as I had mentioned earlier. Is there any other complication that I would like to talk to you about today? Yes. A few of the skin manifestations due to long-standing diabetes. There are a number of skin changes that occur in diabetic individuals, but what we commonly encounter is the fungal infections due to uncontrolled sugars that we see in the skin. So if you have any itchy, red, scaly lesions in your armpits, your private parts, or you have any curdy white discharges from your vagina, or any discharge from your private area, or any white lesions between your toes, please get it checked with your physician and get, if it is a fungal infection due to uncontrolled sugars, get respective antifungals prescribed. Please don't do anything or don't get any prescription over the counter. Don't go ask your pharmacist for the treatment. Please go to your treating physician so he or she can manage you correctly. Plus, most important again, when your sugars go out of control, these skin infections turn up. So please check your sugars and get them under control. The other very important one is recurrent urine infections. When your sugars go out of control, you also have a tendency to develop recurrent urinary tract infections, and this in turn can worsen or trigger the progression of the underlying kidney disease in you due to long-standing diabetes. So if you have any urine infection, please make sure you get it completely treated by your physician. The other complications, what we call as macrovascular complications due to diabetes, are the effect on the cardiovascular system, the cerebrovascular system, and our peripheral blood vessels, that is the peripheral vascular disease. I won't go into detail of those, but yes, please get your heart checked regularly every year. Make sure you get an ECG done, and as per the advice of your physician, get a treadmill test or an echocardiogram done, because each individual, the tests and the treatment management is different. So please don't get yourself tested, for a cardiac complication. Don't go and do a TMT without the prescription of your physician. Let your physician check you and then prescribe what is required for your heart check. So commonly done ECG, TMT and an echo. Along with that blood test, please get your lipid profile done and make sure your cholesterol levels are under control. If they are high, get the necessary medications prescribed, take them, and also maintain a healthy lifestyle, dietary and exercise changes so that these lipids are also under control, thereby keeping these complications at bay. So in general, how do we manage diabetes? What are the dietary changes? What are the lifestyle changes? What are the medications we have? More in my future videos. Thank you.